News 4. I'm Paige Hulsey. It is March, and March is National Kidney Month. Right now, the medical community is working to understand the racial and ethnic health disparities related to kidney disease. And so to talk about this issue, as well as a new study that SSM Health St. Louis University Hospital is part of, SLU Care physician Dr. Krista Lentine and also patient Daryl Cunningham join us today. We appreciate you being with us. So, doctor, can you explain a little bit about why do African Americans have this increased risk of kidney failure?
Thank you for having us, Paige. And first of all, I did want to say Happy World Kidney Day. And across medical disciplines, it's increasingly recognized that categorizing race as a biologic rather than a social construct, it contributes to health disparities. And this problem is particularly apparent in the burden of kidney disease, which impacts the Black community approximately 3 to 4 times as often as white persons. So at St. Louis University, we are working on 2 studies related to recent recognition that a portion of this kidney disease burden is driven by genes. Kidney risk variants in a gene called apolipoprotein L1, or ApoL1, are present in some persons of recent African ancestry. And inheriting 2 kidney risk variants, one from each parent, is associated with increased risk of kidney problems. And Mr. Cunningham is here to share his experience.
Yeah, I was going to ask you, Daryl, I feel like I should call you coach, a successful high school basketball coach joining us today. Tell us about your recent experience. You recently got a kidney from your cousin, right?
Yeah, thanks for having me also. My cousin, Tanya Woods, gave me a kidney. SSM St. Louis Hospital was great. First of all, the doctors, the nurses, and the staff. I received a transplant from them, and only to learn that they did a study, and the ApoL1 gene is a high-risk gene in which I received one from each parent. So it really helped me with my underlying cause. I went to a plant-based diet, and my kidney function improved by 10%, only for it to decline. And there's a lot of things that go through your mind. What did I do wrong? What else could have I done? It was affecting my daily life. But then I got some closure to the situation, learning that it was the ApoL1 gene and that it was a genetic issue and not just a personal issue, something that I did wrong.
Well, quickly, before we let you go here, you have decided to be included in this research. Why did you think that was so important?
I thought it was important because it can help someone else. It can help someone else get closure to their situation. It gets information out there about kidney disease, and I think that's very important, especially in our community. We tend to be quiet. I was very quiet about my situation. It started when I was a college coach at Indiana State University. I didn't want to let the information out, but I want to let people know that it's okay to talk to someone, get information. There's a lot more information out there now over the internet and also through St. Louis University Hospital.
Well, thank you so much for being willing to share your story. And Doctor, thank you for the research you're doing. Also have to wish your daughter good luck as she is playing a championship game right now.
She is. Go Sierra and go Liberty Middle School in Edwardsville.
Thank you so much for being here. Thank you both.
Thank you.
All right.